Well, good afternoon again, everyone, and welcome to the 43rd Annual Legislative Conference, brought to you by the Congressional Black Caucus Foundation. And this is a really terrific opportunity for you to be able to hear some really great information about some very critical health and healthcare issues. We actually, I always forget to do this. For those of you who don't know me, my name is Marjorie Innocent, and I'm the Vice President for Research and Programs at the Foundation. My primary background is actually in health and social policy, so while I'm very interested, of course, in health and healthcare outcomes, and what that means for the healthcare system in and of itself, I'm also very interested in what it is that we need to do, especially from a policy standpoint, to encourage better health outcomes for people in other areas. So that's actually the lens through which I always see all health-related matters. We first hosted this luncheon in 2005, and the idea actually came to mind as we were looking at a variety of health issues, including some chronic disease issues that have been increasingly affecting the African American community, and we wanted to make sure that as we launched the conference, those issues were really brought to bear to the attendees' attention. And I don't know if anyone was here, but the very first one was actually on obesity and chronic disease, particularly on the individual level, and talking to people about what they can do from a behavioral standpoint, especially around healthier eating and more active living. And Dr. Rowe was actually our guest speaker for that one. Was anyone there by chance? No? Well, I think what this really shows is that since then, we have covered a variety of conditions, and the event really has grown. We've covered topics such as mental health, the expansion of community-based healthcare, stroke prevention, well, stroke awareness, I should say, and prevention. And we really are pleased to see the response that we've gotten from the local community and the national community as people really continue to attend this event and really participate very actively in the information that's shared. So again, we are gathered here today to talk about another very, very critical topic: early prenatal care, preventing preterm births and birth defects, and also the growing use of modern technology to really help to improve outcomes around maternal and child health. You will hear from a very, very impressive group of speakers about these issues, and you'll be able to have the opportunity also to engage with them during the Q&A period. We will absolutely make sure that you get the opportunity to ask them questions. Allow me to thank our speakers and our sponsors very personally for their contribution to this event, not just today, but even from the planning phase. And I definitely want to thank you all for being here today as well. I do want to mention, for those of you who might have known, R&B singer and actress Brandy was actually supposed to join us today, but unfortunately, because of a schedule conflict, as often happens, she won't be able to join us. Nonetheless, we are really looking forward to a fantastic event. Congresswoman Donna Christensen, who always comes to this event, was facing the possibility of not being able to come also because she has a hearing scheduled. However, last word I heard, she is absolutely planning on coming and bringing you all greetings, so let's keep our fingers crossed that that will be able to happen as it always does. I do want to draw your attention to two resources that you all should have received at this point in time right outside the room. The first is this guide. It's a blue-covered guide on the Affordable Care Act. It's very detailed and really lays out what we believe to be the main provisions that are really focused around health equity and increased access to health care to really help to address the problem of health disparities. The other is a shorter document which really focuses on the implementation of the Affordable Care Act, especially as it relates to insurance provisions, healthcare coverage, as well as expanded community-based healthcare. We really hope that you will take a good look at those and that you will find them useful. They're also both available on the CBCF website at www.cbcfinc.org under our publications side, on the publication side of our main page. One last thing that I do want to mention to you, we are absolutely on social media. Please check out our Facebook page, which is Congressional Black Caucus Foundation. You go on Facebook, you look for that, and you'll find us. Make sure you like us, please. And also, if you are on Twitter, please tweet using the following hashtags: ALC 2013, and the theme of the conference, It Starts With You, all in one word. To start us off officially, I ask you to give a very, very warm welcome to the Foundation's President and CEO, Ms. Shawnice Washington.
Thank you, Marjorie, and good afternoon, everyone. Good afternoon, everyone. How's lunch? Isn't the tea fabulous? I mean, the tea's really good. I'm from the South, so, sweet tea anywhere other than South Carolina is like an anomaly. But this raspberry tea, whatever the caterer's got going on, I mean, it's really, really, really good. So welcome to the Congressional Black Caucus 43rd Annual Legislative Conference and to this year's Health and Wellness Luncheon. As my colleague just mentioned, today you will hear about some of the major health risks facing infants in the African American community: preterm births, low birth weight, birth defects, and infant mortality. You will also learn about the critical role of prenatal care and preconception health in preventing these conditions. We hope that you will find this information useful, and we ask that you will share it with your family and friends. At CBCF, we strive to provide valuable and timely information to African Americans to help them live healthier and more productive lives. One example is our Spirit of Healthy Living program, which is sponsored by Johnson & Johnson. Through this initiative, we work with health ministries and African American churches to raise awareness about diabetes prevention and management. And we help connect churches with local resources to help them promote and adopt healthier lifestyles. We are also part of the Act Against AIDS Leadership Initiative, sponsored by the Centers for Disease Control and Prevention. This initiative harnesses the strength of 19 civil rights organizations to reach communities hardest hit by HIV and AIDS today. As you're all aware, we offer the Louis Stokes Urban Health Policy Fellowship for young professionals who are committed to addressing health disparities through public policy. This program is opening doors for some of the brightest young leaders in health policy, including Daniel Dawes. I suspect many of you know Daniel. He was a Stokes Fellow in 2006 and 2007 and is currently the Executive Director for Government Relations, Policy, and External Affairs at the Morehouse School of Medicine. During health reform negotiations, Daniel worked closely with the White House, Congress, and hundreds of stakeholder groups to ensure the health care reform law included equity provisions to reduce health and health care disparities among vulnerable populations. By the way, Daniel is also the co-author of our popular community guide on the Affordable Care Act, as well as the update brief you received today. We are thankful and proud of his accomplishments, as well as the successes of our other Stokes Fellows. Our work at CBCF would not be possible without the support of our numerous partners, and this event is no exception. Please join me in a rousing round of applause for Verizon, Johnson & Johnson, and the March of Dimes. Thank you for your sponsorship and your collaboration in enabling us to every day make a difference in so many lives. I also want to thank our impressive panel of experts and advocates for their time and dedication, and they'll be introduced and brought to you later in the program. And also, as Marjorie mentioned, we are on Twitter, so please tweet about the event, hashtag CBCFINC13, or hashtag It Starts With You, which is our theme this year. Instagram photos to CBCFINC. Please like us on Facebook. And also download our mobile app at CBCF ALC 13, and you'll also find updated information about our issue forms and brain trusts, which will be provided in our ALC daily publications. Thank you again for joining us, and know that when you give to the Congressional Black Caucus Foundation, you support programs which provide scholarships and leadership opportunities to deserving students, teach young men and women to direct efforts in their community that spur positive change, and prepare future African American leaders for a life of public service. Thank you so much for your presence, your support, your friendship, Enjoy the rest of your day and the rest of the conference. Thanks so much.
Thank you so much, Shawnees. As Shawnees just mentioned, we really are incredibly grateful for the continued support that we receive to do the work that we do, and we really, really value the partnerships that we have established over the years. I do want to provide an opportunity for our sponsors to bring you some greetings as well. And at this time, I ask you please to welcome Ms. Deborah Speed, Executive Director for Public Policy and Strategic Alliances at Verizon.
Good afternoon.
Good afternoon.
Well, Verizon is proud to sponsor, and first of all, let me say I'm delighted to be here today. And Verizon is proud to sponsor the Health and Wellness Luncheon. And Verizon is also a proud partner and proud to support the Congressional Black Caucus Foundation. We value the work that you do and the contributions that you make every day to our society. So thank you so much for that. Now, I know people are probably out there wondering, Verizon, a telecommunications company, a network company, why are they sponsoring a health and wellness fair? What is that connection? So I'm hoping by the end of today, with my colleague Anthony Lompart, and what you hear from us today, the next time you think of Verizon, I'm hoping healthcare will be one of the terms that will come to mind. So now, from our wireless to our cloud computing, to our fiber networks, Verizon has invested $150 billion in our networks. And these aren't one-offs. We've invested, these highly innovative networks require ongoing investments. So we're talking, we spend about $6 to $8 billion annually to maintain our networks. And at Verizon, we believe the power of the network can change just about anything. That is why Verizon has restructured itself around a philosophy we call shared success. And what that is taking what we do best, our networks, our philanthropic resources, our talent, and our time to come up with powerful answers for some of the key pressing issues of our time, which is healthcare is at the top of the list. So at Verizon, what we're doing is we're using our networks to connect them intelligently to healthcare networks so that we can reduce costs and improve patient outcome. We have an mHealth platform that will put tools in the hands of doctors and patients so they can better manage chronic diseases. And as we know, I think it's $3 trillion is spent on healthcare. Half of that is spent on chronic diseases that plague our communities most. So let's say, for example, we have a mom-to-be who has developed gestational diabetes. With the use of technology, a doctor and a highly secure network, a doctor can remotely monitor the mother between visits. So if there's some alarming symptoms that come up, the doctor can call in the patient or change the regimen and be able to adjust her regimen so that if there are problems, we can address them immediately in real time. Verizon is also using our powerful networks to address access to care. As we know, 20% of Americans live in rural areas, but only 10% of the doctors serve them. With the use of technology, we can bridge the gap to bring the resources of doctors directly to the homes of people that live in rural areas. So for example, my in-laws, they live in rural part of North Carolina. Sometimes they have to travel 2 hours to get to a doctor. And then they travel the 2 hours just to get to the doctor, and the doctor say, oh, that's just a rash. You really just need to have some ointment and then send them on their way. With the use of technology, my in-laws can use a secure device, a 4G network, a smartphone, and be able to consult with the physician 2 hours away. Now, Anthony, my colleague, he's from the Verizon Foundation, and he will talk about how the foundation is using its philanthropic resources to transform healthcare in underserved communities. At Verizon, we understand we can't do this alone. We're not the doctors, we're not the physicians. So what we do is we have innovation centers where we collaborate with doctors innovators, entrepreneurs, universities, to use our technology to come up with powerful answers, not just for healthcare, but education and energy. So now I'd like to show you a video, a 90-second video about how Verizon is using its technology to come up with powerful answers.
What do we want to build next? That's the question. Every day, when you have the most advanced tools, you want to make something with them. Something that helps. Helps safeguard our shores. Helps someone see through a wall of fire. Helps those nowhere near the right doctor stand a chance.
Vitals look good. Any thoughts of feeling in the extremities?
Technology can do that. It can take a sick kid to school.
Tell me the third life cycle stage of the frog. Nathan. Tadpole. Tadpole without gills. Excellent job.
Help ensure a constant supply of clean energy. The things we build share one belief, that the world's biggest challenges deserve even bigger solutions. Powerful answers. Verizon. What do we want to build next?
So that's just the tip of the iceberg of what Verizon is doing with its technology, collaborating with partners to come up with solutions for healthcare, education, and energy. Thank you and enjoy the rest of your conference.
Thank you so much for your comments and for showing us that very, very inspiring video, Deborah. Certainly a lot of food for thought as we move forward and really try to improve everything we do, especially around healthcare. March of Dimes, as you've already heard, March of Dimes and Johnson & Johnson are also sponsors of our luncheon today. And at this time, to bring greetings on behalf of both, I would like to welcome Dr. Diane Ashton, who is Vice President for Health Equity and Deputy Director of Medical Affairs at the March of Dimes Foundation.
Thank you. Good afternoon and welcome to this conference. It should be a very enjoyable luncheon with a lot of important information that we're going to share with you today. I would like to thank the Congressional Black Caucus Foundation for hosting this important event. I would also like to acknowledge some of my colleagues from the March of Dimes, Dr. Edward McCabe, who's our Senior Vice President and Chief Medical Officer, and I'd also like to thank Gwen Carmen, our staff member, who has made this event possible for us today. The mission of the March of Dimes is to improve the health of babies by preventing preterm birth, infant mortality, and birth defects, and we do this through several important partnerships with different organizations. I'd like to acknowledge our friends at Johnson & Johnson who work with us very closely on being able to establish some important programs that you'll hear a little bit more about today. And I'd like to acknowledge Joy Marini, who is the Director of Corporate Contributions at Johnson & Johnson. She's been the lead for our work together with some of our programs, Healthy Babies Are Worth the Wait, and for her longtime support and being able to accomplish all that we have done together. The African American women, we know, are nearly twice as high a risk of having preterm births than other racial and ethnic groups. And our partnership with Johnson & Johnson began when we were thinking about what could we do to impact birth outcomes in general. And we have continued in this journey looking at health outcomes for African American women also. So we would like to thank Johnson & Johnson, our partner, for their vision and collaboration on the program Healthy Babies Are Worth the Wait. This began as a demonstration project in Kentucky, and now since 2011, we have expanded to look at issues that impact preterm birth for African American women in Newark, New Jersey. And we have been developing this program through community partnerships, and we now have approximately 75 community organizations who work side by side with us, investigating what are the specific issues that make a difference for African American women's health, and helping to prevent preterm births in general. One facet of this program involves examining birth data to see what are the major areas we can make an impact, identifying what are the common modifiable risk factors for preterm birth and poor birth outcomes for African American women, and developing interventions and educational materials that we feel can really make a difference in the lives of African American women. We also have partnered with the Healthy Mothers and Healthy Baby program since its inception, and now with the Text for Baby program. And this program is also supported by Johnson & Johnson, and it provides important educational messages to thousands of pregnant women and new mothers. So we truly value the relationship and partnership that we have with Johnson & Johnson, and we're pleased that they're able to join us here today. I'm glad to see that there are many men in our audience today, and just one word that I wanted to impart: although we focus on women's health is really the health of everybody, because we think about chronic medical diseases, also hypertension, cardiovascular disease, and the origins for many of these problems begin in the womb. While women are pregnant, they are predetermining some of the health outcomes that their child will have as an adult. So it's very important that we think about women's health, that we think about preconception care, that we think about how we can improve women's health. And because of that, we know that African American women are very important because we have more health challenges. So thank you this evening. I hope you enjoy our presentation. And I'm happy to answer any questions that anybody has, and please contact the March of Dimes if you need additional information. Thank you.
Thank you very much, Dr. Ashton, for your comments and for your support, and for being here with us today. At this time, I am very, very pleased. Actually, sidebar. I was about to introduce our moderator. However, she is absolutely on cue. Very, very pleased to welcome to the podium our absolutely #1 advocate around health care, health policy, health equity in Congress, Congresswoman Donna Christensen.
Good afternoon. Thank you, Marjorie. Busy day, busy week on Capitol Hill. Talk to you about some of that in a minute. But good afternoon to everyone. Good afternoon. It's always great to see a wonderful turnout for this luncheon. And I want to thank you for inviting me again. I want to give a special thank you to Shanice, our President and CEO, to Marjorie, Vice President of Policy and Programs, for organizing this and all of the luncheons that they've organized over the year. But this year, to focus on such a critically important topic as Head Start and the role in keeping babies, our babies in particular, healthy before and after birth. I also want to thank and welcome our moderator, Michelle Miller from CBS News, as well as all of the panelists this afternoon. I really appreciate all of you taking time out of your schedules to be here and to share information with all of us. I know that everyone here knows about Head Start and early Head Start programs, the myriad benefits that these programs extend to women and children who otherwise would be left out in the cold. The health benefits not only are comprehensive, but studies confirm. They don't guess, they don't speculate, they confirm that children in Head Start and early Head Start programs have lower rates of mortality, especially in ages 5 to 9. Children in Head Start and early Head Start programs were more likely to receive dental care, more likely to have parents who report that they're in good health, and more likely to have had their immunizations. Of course, the benefits also extend to parents. In fact, studies confirm that parents who participate in Head Start and early Head Start have a higher quality of life, that's what they report, and overall satisfaction. And they have greater confidence in life coping skills, lower rates of depression, anxiety, and illness. And that's why protecting Head Start and early Head Start from cuts and from changes to the program is a high priority for the Congressional Black Caucus. But beyond Head Start, healthy babies require healthy communities. And that's the broader focus of the Congressional Black Caucus. So yes, our Health Brain Trust focuses on health disparities, one of the most disturbing of which is that twice as many of our babies die in their first year of life compared to their white counterparts. And that's something that not only our caucus and all of you, I know, find intolerable, but our country should be ashamed of it as well. Because of our high infant mortality rate, our country rates below some even developing countries on infant mortality. So mothers, and yes, fathers too, need to be healthy. And the Affordable Care Act, through Medicaid expansion and through the health insurance exchanges, which make insurance affordable, finally gives millions of those mothers and fathers access to health care. We want our moms to be healthy when they get pregnant and to be able to plan their pregnancies. And that's how we have healthy babies. Years ago, we did a Health Brain Trust session on early childhood brain development. And what we learned was that the stresses in our communities affect our babies even before they're born, and certainly after. Very importantly, our babies need a nurturing relationship and environment, especially in those first 3 to 5 years of life. This speaks to health access, to better child care, and early childhood education, and of course, to early Head Start and Head Start. But it also speaks to the elimination of poverty, to job creation and economic development, to quality education in all of our communities, to healthy foods, improved housing, non-polluted environments. These and all of the related issues that comprise the mission and the work, the agenda of the Congressional Black Caucus. And I would be remiss to come here today if I didn't say something about what's going on the Hill this week. Among the many drastic cuts that are on the table as we prepare to finish our work on next year's budget is a drastic and egregious cut to food stamps. And this is coming at a time when poverty, unemployment, and food insecurity and even hunger in this country is at an all-time high. So we need you, because you come from all parts of our country, all across our country, to let your representatives know, and let your family to let their representatives know that you will do everything possible to ensure that they do not get reelected next year if they vote for a $40 billion cut in food stamps. That cut is over a 10-year period, but in 1 year, and next year, it could kick 3.8 million people off of food stamps. And over 40% of those people will be women. So we have a lot of work to do. But we're glad that you're here. There's no more important effort for all of us to be involved in than to ensure the well-being of our children. It is critical for them. It's important to our communities. But it is also vital to the strength and the competitiveness of our nation. So thank you for being here again, and thank you for your commitment to our children.
Thank you so much, Congresswoman. We really appreciate your taking the time to come out today. She, as you might have heard earlier, she is actually in hearings right now, so really happy that she was able to come with and join us for a short while. So now, at this point, I am very, very pleased to turn the reins over to the very, very capable hands of our esteemed moderator for today, Michelle Miller, who is a CBCS News correspondent. Michelle is actually an award-winning correspondent who is based in New York and reports for all CBCF news broadcasts and platforms. Her work appears in a number of shows, including CBS Evening News with Scott Pelley, CBS This Morning, and CBS Sunday Morning with Charles Osgood. While at CBS News, she has reported on several national and international breaking news stories and has received several awards throughout her career. Michelle is married and the proud mom of 2 children. Please welcome our moderator for this event, Michelle Miller.
Good afternoon. Glad to be here. We have a lot to do today and a lot to get through. I'll move this up here. And I just want to first off thank the Congressional Black Caucus Foundation for hosting us today and its efforts to develop this annual health luncheon, certainly the March of Dimes, Johnson & Johnson, Verizon, and really to talk about something that's important because it's something that I've found to be important for the last 10 years. I've served as a member of the advisory council to the March of Dimes. I've volunteered with them in their whole mission to prevent birth defects and to birth healthy babies. So I understand the significant work that the March of Dimes does and really applaud them for continuing the effort to reduce infant mortality. Dr. Ed McCabe, where are you? Thank you so much. I want to give you a special thanks. He's the March of Dimes Chief Medical Officer and Senior Vice President. Thank his team for assembling us all here today and for this incredible panel, and I'm going to introduce them to you now. And I start with Dr. Wanda Barfield, who's Captain, U.S. Public Health Service and Director of the Division of Reproductive Health, the National Center for Chronic Disease Prevention and Health Promotion, and the Centers for Disease Control and Prevention. And as I call you up, would you please just step right on up here, because we're just going to get this ball rolling. She has a staff of over 180 members and a budget of about $43 million, and is responsible for promoting the CDC's Safe Motherhood and Infant Health Initiative. So give her a big round of applause. I'm going to introduce everyone, and I'd love them just to come and sit up here with me. Anthony Lumpart is the Director of Innovative Healthcare, the Innovative Healthcare Initiative at the Verizon Foundation. Come on up, Anthony. To talk about what he does, he creates technology and enables healthcare programs to partner with forward-thinking healthcare organizations that target improving access and quality of healthcare for underserved communities here in the U.S. and internationally. So we really appreciate the work that he does. In addition to Anthony, we have our fabulous family, the Fleming family, and would Nikki and Denzel please come up and join us as I introduce them. This family is from North Carolina, and Nikki and Denzel, along with their daughter Lauren, spent a year as the March of Dimes National Ambassador family, traveling around the country to share their story of preterm birth with other families, with communities, with government leaders. I mean, they got the word out to let folks know in corporate communities just how important it is to raise funds for the March of Dimes, because it is a crisis. Prematurity in communities, in particular communities of color, is at crisis levels. And today, Lauren has her younger sister, Erin, here. She has a younger brother, Corbin, as well. But we just are so proud. I want Lauren to stand up and wave to everybody so they can see her, because she served as the 2001 March of Dimes National Ambassador. And she put the face on premature birth. And look how healthy and happy she is. Come on, stand up now. Stand up. You are like loud and proud. Yes, Aaron, you stand up too. So we're gonna start with Dr. Wanda Barfield, and I'm just gonna call her Dr. Wanda because we're all family here. She is going to talk to us about what it is that she does to set up the framework for. She's going to set up the framework for why preconception health matters and what our moms-to-be need to know to have healthy babies. So, Dr. Wanda, please, without further ado, step right on up.
Good morning, everyone, or good afternoon now. Good afternoon. First, I just want to thank Dr. Marjorie Innocent, Shanice Washington, Congresswoman Donna Christensen, Dr. Diane Ashton of the March of Dimes, Deborah Speed from Verizon, Johnson & Johnson, and members of the Congressional Black Caucus Foundation for inviting me to speak to you today. Now, I'm going to talk about a real Head Start. Although we know that Head Starts for babies are critically important, but we have an opportunity to think about a real Head Start and about how we can keep mothers healthy before and after birth. I know that you're aware of the persistent racial disparities in infant mortality rates over the past several decades. And despite the decline, mostly credited to medical advances, infant death rates for Black infants are twice that of whites. And in 2011, there were just over 11 Black infant deaths per 1,000 live births compared to 5 white infant deaths per 1,000 live births. You may also know that there are substantial differences in infant mortality rates by geographic region. Now, a cursory glance, infant mortality disparities follow populations with high African American births. However, the major drivers of these differences are due to birth defects, very preterm birth, and sudden unexpected infant death, or something called SUID. Now, CDC's main objective is to protect health. And we do this in a lot of ways. One way is to prevent chronic disease and promote health. And at our center, we support public health infrastructure, promote healthy communities, and healthy care environments. I'd also like to just tell you a little bit about the division. Now, the Division of Reproductive Health promotes optimal reproductive health for a healthy future with a focus on equity. Our funding comes mainly under the Safe Motherhood and Infant Health Initiative, and we have 3 focus areas. First, women's reproductive health, which includes family planning methods, services, and utilization, chronic disease prevention of women of reproductive age. And the second area is in pregnancy health, and that's addressing maternal mortality and complications of pregnancy and teen pregnancy prevention. In the area of infant health, we focus on sudden unexpected infant death prevention and preterm birth prevention. Now, we focus on taking science to practice in combination with strategic partners to provide impact to improve infant health. Now, this Time magazine cover strikes me every time I see it. It illustrates that pregnancy is just a window of health in a woman's life. And unfortunately, for many, it is one of the few times that women encounter the health system. But specifically, this article discusses the potential risk for adult chronic disease that can be influenced by what is in the fetal environment. So these fetal origins of adult disease, as described by the late Dr. Barker, are influenced by the maternal environment. So, for example, a fetus that is exposed to a mother with gestational diabetes has an increased risk of diabetes in adulthood. And fetuses born at term with a low birth weight, a proxy measure for growth restriction, are at increased risk for hypertension and cardiovascular disease. But the health of babies is not only influenced by the health of mothers. It's also influenced by factors that influence maternal health, including fathers, family, and society. So if the fetus is influenced by maternal health, what's the state of health of women of reproductive age in the U.S.? Well, we know that women aged 18 to 44 in the U.S. have 19% who smoke, 25% are obese, 23% are physically inactive, 14% have high cholesterol, 10% high blood pressure, and 13% have current depression. Not postpartum depression, but current depression. And we know that there are large disparities by race. So according to data from CDC's National Health and Nutrition Examination Survey, the prevalence of obesity for females has increased over time with age. And what's particularly concerning in these series of diagrams that go from age 2 to 5 years, 6 to 19 years, 20 to 39 years, and then 40 years and older, is that as girls age into women, the prevalence for obesity more than doubles for Black and Hispanic females before and during their reproductive years. The gap at the bottom is closer, but that's because white women then start to increase in their obesity risk. So why does this matter for potential health? Obese women have an increased risk of reproductive health complications, which range from difficulties conceiving and getting pregnant, increased risk of pregnancy loss, including stillbirth and miscarriage, as well as increased risk of birth defects, complications of labor and delivery, and increased C-section and postpartum complications. So in some examples, hypertension among women also shows significant disparities by race, with a prevalence of hypertension of 40% among Black women. And one of the challenges is that African American women, it may not be clear at this time whether the hypertension actually occurred during pregnancy or before pregnancy, again, because we're not seeing women accessing health care. And without adequate primary care and postpartum follow-up, there are opportunities that are lost in order to prevent some of the long-term consequences of hypertension, including heart disease, stroke, and premature death. This slide displays the prevalence of diabetes among adult women over a span of more than 20 years. And the percentage of women with diabetes is increasing, but more so with African American and Mexican women. The prevalence of gestational diabetes is not shown here, but it's really a matter of debate, ranging from about 5 to 10% of pregnancies. But again, part of the challenge is that women who are diagnosed with gestational diabetes may actually have pre-existing diabetes or be at risk for diabetes after pregnancy. So our division has monitored pregnancy-related death in the United States since the late 1980s. And here, over time, compared from 1991 to 1997 and 1998 to 2005, the leading cause of pregnancy-associated death is now currently due to chronic disease. In addition, racial disparities in pregnancy-related deaths increase with maternal age. So overall, Black women have over a 3-fold risk of pregnancy-related deaths compared to whites, but it increases to 4-fold in older age groups. So what are our opportunities to reduce disparities and increase health equity? So here are just a few examples. First, by providing quality care and reducing costs. Second, by improving access to care. And as you may know, currently, about 2.8 million African American women are uninsured. And this represents 16.3% of African American women compared to 11.8% of white women. And then lastly, we can inform consumers of prevention health choices, and you're going to hear more of that today. So, the Affordable Care Act does provide an opportunity to improve the health of African American women in these ways. By covering some of the key preventive services, improving the quality of care, and improving access to health care, and providing information and assistance to consumers. So here's some opportunities in terms of improving quality of care. And I must say, the most important thing has been the wonderful collaborations in the public sector, in the private sector, and with regard to the federal government. So here are several examples. The March of Dimes, as you may know, has been a champion in the fight to reduce preterm birth and has focused its efforts to encourage mothers and inform providers on the benefits of a full-term pregnancy. And this has paid many dividends through their collaboration with Johnson & Johnson, communities, states, national and federal organizations. And it's helped us to see further declines, as we've seen most recently, in the reduction of preterm birth, which is now reduced to 11.5%. Partnerships with multiple states has also been an important opportunity to impact infant health, and states work very collaboratively in order to improve their data and their practice and their policy. So these are just a few examples, one of which is the Collaboration on Innovation and Improvement Network, which involves southern states that are trying many ways to reduce infant mortality and associated disparities. CDC also supports statewide quality improvement collaboratives in California, New York, and Ohio, and also the Preconception Health and Healthcare Initiative and the Sudden Unexpected Infant Death Initiative. These opportunities create an environment where we can increase the quality of care by reducing the risk of birth defects, by increasing access to effective technologies such as steroids during pregnancy, the opportunity to increase healthy sleep environments in the reduction of SIDS and SUID. Another way that we need to improve health care is through access, and this is an area that I'm very passionate about. As you may know, in the United States, we have a lot of technology, and the way that we are able to effectively prevent preterm birth in terms of the risks is astonishing, and infants are surviving, and you're going to hear more about that today. But place really matters for very low birth weight infants in terms of their opportunity to reduce the risk of death. And in fact, very low birth weight infants, those weighing less than 3 pounds, 5 ounces, have over a 60% risk of death if they are not born in a level 3 or higher facility. Yet in states, we know that there's a lot of variation in definitions, criteria, and monitoring. So we must think collaboratively about the opportunity to improve access to care. Lastly, and I won't go into a lot of detail because you're going to hear more here, but it's important for us to inform consumers and providers. Text for Baby has been a wonderful collaboration with many, including HHS and CDC. Our collaboration involves actually looking at the medical accuracy of the text messages so that mothers are really well informed. But this Text for Baby and the activity as a mobile health opportunity has reached over 610,000 women. And what's really nice about Text for Baby is that they're really reaching low-income women and minority women. Peristats is another opportunity in terms of reaching consumers. It's very user-friendly, and the data that's used there is really important in terms of informing parents as well as providers. I want to also just talk about 2 other areas of health information, and that's the U.S. medical eligibility criteria for contraception and the U.S. selective practice recommendations. These are CDC evidence-based recommendations that provide information about the effective use of contraceptives, and what it's doing is dispelling myths. For example, women who have a chronic condition now have an opportunity to look at what their specific risks are with regard to contraceptive use. Also, for example, with regard to teen pregnancy, we know that teens are eligible for a wide variety of contraceptive methods regardless of age. So just to point out some of the available services within the ACA. In addition to perinatal care or prenatal care, we have opportunities to look at well woman care, and that really is a critical area if we're going to try to adequately address issues with regard to access to care. A primary care visit will be extremely important. So I just want to end by saying that in order for us to have a real head start in the health of babies, we need to improve the health of women. And the ACA does have the potential to improve the health of African American women before and between pregnancies, not only to give babies a healthy start, but to give mothers a healthy start too. Thank you.
I still haven't figured out how to use PowerPoint. She does a pretty good job, if not an excellent job at doing that. Thank you, Dr. Barfield. Now to hear more about some innovative ways that Verizon is using technology, its modern technology, to keep moms and babies healthy. We're going to ask Anthony Lampart, Director of Innovative Healthcare Initiative for the Verizon Foundation, to join us up here, and take it away, Anthony.
Thank you, Michelle. Thank you for the Congressional Black Caucus Foundation for allowing us to be part of this event today. I'm one of the few people at Verizon who's lucky enough to work in an area where we get to pull together our assets in philanthropy and our technology and put them to work in underserved populations across the United States. And I tell you that I whistle to work every day. I absolutely love what I do. And I get to go out into the field and partner with nonprofit organizations delivering healthcare in underserved areas, minority populations, addressing rural access issues across the South and in the frontier areas of the Midwest. And I get to see what technology can do in the area of healthcare, addressing the needs of underserved populations. So what I'd like to share with you is my work today, and I get really excited about my work. So one is I'm going to start with a little bit of the numbers and what I call transformation through the convergence of opportunities, which means when certain conditions occur, things transform. Then I'd like to tell you a little bit about the model and what my model is doing for underserved populations. And then I'm going to give you two real-life stories, ending with one right here in DC that we're particularly proud of. Fair enough? Where's the buttons here? Okay, a little bit about the numbers and the convergence of opportunities. So 75 cents of every healthcare dollar spent in the United States is on chronic disease. You heard the doctor just mention a lot of alarming statistics around chronic disease and this growing problem in the United States. 75% of every dollar, 75 cents. Most of these chronic disease, the good news is that they're manageable or preventable even through behavior interventions or behavior modifications. What does that mean to the average person that's not a doctor like me? That means if I know enough about what's going on with me or my children, then I can do things differently, educate myself and do things differently, and manage chronic disease better or even prevent chronic disease. Heart disease, diabetes, lung diseases. In children, this is asthma. In children, this is obesity as a precursor to heart conditions and early onset diabetes. These are things that empowered patients and empowered parents, empowered mothers, can help manage and really improve disease outcomes. And we believe that a convergence of information or a convergence of opportunities with technology can help that. 20% of minorities or 20% of underserved patients are more likely to have a chronic disease than their white counterparts. 50% of minorities express trouble understanding or remembering doctor's instructions. What does that mean? Those of us who've had parents alive today understand or have heard this conversation before. Mom, what'd they tell you at the doctor? I don't know. He said, blah, 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 but I don't know. I don't remember what he said. So this is real world for us. This is real world for many of us. Cell phone ownership or mobile device ownership, 90% of us have mobile devices. 83% of African Americans have mobile devices. Most of you sitting here today have a mobile device in your hand or on the table right now. Mobile use is inversely proportionate to income. In other words, many times technology benefits don't reach the underserved populations because it's an income issue, because the benefits of this happen first for the privileged, then later for the underprivileged. That's not the case in mobile devices. Almost everyone we know, doing well or not doing well, has a device, yes or no?
Yes.
90% of text messaging is read in 3 minutes. Within 3 minutes of you getting a text, you read your text. 2.5 trillion texts per year carried over the United States networks alone. This is a convergence of opportunity. This is a convergence to use this information everywhere at any time for everyone and use this to the advantage of some of the most challenging issues in healthcare today. So I'm going to tell you about my work, and then I'll give you some examples. So we're partnering with nonprofit organizations that are providing care today across the United States in underserved areas. Nonprofit organizations that serve children, that serve women, and that serve seniors. Our programs help them with the ability to connect and transform their patient care delivery models. So we're only partnering with organizations that actually have patients, that they're help treat right now, who have difficulty to access and quality health care. What we're doing might be as simple as giving them tablets and smart devices and funding to staff certain trials around texting platforms, or more complicated, trying to implement mHealth solutions, capturing biometrics, using scales that when you step on them, they capture your weight, they send it up to the cloud, and they put it on the internet before you could get off. With devices that measure glucose, devices that measure blood pressure. These devices can capture that information and send them to your provider. So then the future, the healthcare visit is like this. In the past, it was, good to see you again, Miss Emma. How's it been since the last time I saw you, which was a month ago? The future visit's gonna be, I've seen your blood pressure readings for the last 30 days. Are you doing the things that we talked about when you were here last? Because A, you're getting better, so you are, or B, you're not getting better, so you're not listening to what I'm telling. So we're connecting these organizations and helping them transform communication. We're using those connections to help them communicate more and educate patients. This is using texting to advise on medication adherence. This is using appointment adherence alerts. Remember that on Thursday at 3 p.m. you still have a doctor with your an appointment with your specialist. This is educating on chronic disease management, on dietary needs, on better food choices, on reminders of mobility that help people stay active. This results in an empowerment of patients. Patients become more informed. Patients then learn things about their conditions and their children's conditions. Women can make better decisions on the fly that result in better healthy behaviors, and those better healthy behaviors support improvements in chronic disease. So as this information gets into this funnel that I'm showing you here, families get educated on how to support their loved ones. Patients get empowered to manage their own conditions. Providers talk more to their patients through the use of technology, and the outcome is better disease outcomes and fewer emergency visits, because 75 cents of every dollar is being spent on chronic disease. I'm going to tell you a little bit about a couple of our partnerships as promised. One of my partners is the Children's Health Fund. They've been around for 25 years. They started in New York City, and now they operate in 17 different states. They operate 50 of these mobile medical units. These mobile medical units are not screening mobiles, they're doctor's offices. Yes, they are pediatrician doctor's offices stopping every day at homeless shelters, at low-income schools in the inner city, at towns that are far from hospitals across the South, who were some of the most important responders to the events in New Orleans. These people do God's work. We've partnered with them at 6 different cities to trial some technology-enabled solutions. San Francisco, Phoenix, Arizona, Dallas, Detroit, New York, and Miami. I'm going to tell you a quick story about the child in Miami that utilized that equipment that's standing right there. So that's in that photo. So imagine this. This young girl lives on the outskirts of Miami. We all picture Miami as a fun place, but the outside of Miami, in greater Miami-Dade County, there are some really impacted, underserved areas there. And one of the complications there is that there's no public transportation to take you across town to a doctor's appointment. So if you're a mother who has an hourly paid job, going to a doctor's appointment means you don't get paid. It also means you need to find a car. If you don't have a car, you need to get someone to help you go. So this young woman goes to school. She's new in that community. She goes to school to enroll. They tell her that to enroll in school in Florida, you need a health evaluation. She comes from a low-income family. She lives with a single mom. So they tell her, go to the Children's Health Fund. The Children's Health Fund will give you a health screening that will allow you to enroll in school. So she goes to the Children's Health Fund. The doctor on the mobile unit sees something on her skin that she doesn't like. She thinks this should be seen by a specialist. So our partnership with Children's Health Fund connected that mobile unit with 4th generation LTE technology, so that mobile unit can communicate via telemedicine with anyone who has a connection to the internet or a wireless connection to broadband data while it's in the mobile environment. So she sets up a specialist appointment with a dermatologist at the University of Miami Hospital. The University of Miami specialist gets on that screen right there, which is equipment provided by the University of Miami. So this is one of those connections where it's in partnership with someone who's delivering expert care. Between the doctor, the patient, and the dermatologist on the screen, she uses that little handheld device right there to focus in on the blemish of this little girl's skin. At that point, the dermatologist makes an assessment of what's on her skin, performs a diagnosis, and proposes treatment that the pediatrician on the mobile unit then prescribes. That issue was solved through the use of technology without need of traveling across town. So the very last one I'm going to talk to you about is closer to home. I partner with a doctor who works here at Children's National Medical Center. Her name is Dr. Ivor Horn, and she has spent the last 16 years serving families in Southeast Washington, D.C. And I want to tell you a little bit about Kimia Richardson and her daughter, Tamara. So one day, Kimia gets a cold, and she's 2 years old. She gets a cold, Tamara gets a cold, and Kimia takes her to the doctor, her nearest doctor in Southeast DC. And she says she gets diagnosed with, she has a cold. Take her home and the regular regimen for a cold. Kimia realizes that something else is going on. In that 1 week, she visited the doctor 5 times. And she still didn't find the right answer she was looking for, and her child was having trouble sleeping and trouble breathing. So she decided to take the trip, 45 minutes, to Children's National Medical Center and went to the emergency room. In the emergency room at Children's National, there's a program called Impact DC, because DC is the #1 city in the United States for asthma. And Impact DC, what it does is it treats families and children right coming out of the ER with disease education around asthma management. And Text to Breathe is a trial that we're working on with Children's National Medical Center that uses texting to help empower mothers manage asthma in their children. And so what occurred was, over the course of 5 doctor's visits, she ends up at Children's National Medical Center, and she finally gets, how should I say, she was interned into the hospital for bronchitis that day. So the baby's now in the hospital. But fast forward a year later, she enrolled in this program called Text to Breathe. Weekly, she receives texts on how to manage Tamara's asthma. She gets texts on how to ask the right questions at her doctor. She gets texts on how to coach Tamara down, for how to detect asthma attacks when they start, and how to coach Tamara down so that she has less usage of her steroid inhaler. In the first couple of weeks in the program, she called the Text to Breathe office 3 or 4 times a week. Today, her daughter's doing so well that she still keeps her texts, but she makes no phone call, and she's reduced virtually all her needs to go to the emergency room due to asthma attacks because she's an informed mother. And so I think I went long here today.
No.
But as I said, I get excited about what our programs are doing in the community. We are very committed to helping underserved populations through the use of technology, improving access and quality of healthcare. And thank you for having me.
Thank you. Thank you, Anthony. I'm going to stay down here because I want to sort of like give the opportunity for Nikki and Denzel to address you from their seats, because their story is really, it's one that I'm sure any parent who's in a situation like them, it comes as a complete surprise, and it comes when they least expect it. And so I'll just let them explain to you how they came to find the March of Dimes.
Wow, I'm just listening to the wonderful presentations. Thank you, Dr. Barfield. Thank you so much for sharing your information. And as they were speaking and I was looking at the PowerPoint presentations, my question to you was, why is this important? Why was Dr. Barfield's presentation important? Why is the support of Verizon important? And my husband and I and my daughter Lauren are a face to why it is so important. We went into preterm labor with Lauren on January 30th of 2004, and then ended up giving birth to her that following Monday. And to do everything right, to be a mother that's healthy, that's young, you know, I was 28, so I was still young. But to be young and to be healthy and to do everything right, you know, I ate very well, my weight was managed very well, and to still go into preterm labor was a shock. It was an absolute shock, because you get pregnant, you think everything is going to be great, you think everything will be wonderful, oh, I'm doing everything right, I'll have this baby, go home, we'll start our life together. Everything that we planned as a couple for our introduction into parenthood was shattered when we had Lauren. She was born at 2 pounds, 1 ounce, and she spent 5 months in the NICU, 5 months. And I know people who have preterm babies or who have had preterm babies, and they talk about spending a week in the NICU or 2 weeks in the NICU, and I try to put it in perspective for them and say, what would you do if your child was, in the NICU for half of a year? And you have to trust the staff at the hospital, you have to trust the neonatologists that care for your children, because as a mother, I didn't get to rock her to sleep at night. I didn't get to hold her or feed her or change her. I missed those first 5 months. And while I never questioned God about that experience, it was still one that leaves you wondering, what could I have done differently, And now, my life being as fruitful as it has been and being able to be here and to speak to everyone in this room and to have traveled 2 years ago, this is the reason why. This is absolutely the reason why. And Lauren, I look at her now, she's 9, she's healthy, she's vibrant, she's strong. She does have residue from her prematurity, and asthma was one of them. And as you were talking about the story of that little, that baby that was in the hospital, we found out that Lauren had asthma through a trauma. She was having a difficult situation, couldn't breathe. I took her to her pediatrician 3 different times, and she gave her albuterol, and she would be fine afterwards, but then it would flare up again. And Lauren was 3 at the time, and a lot of preemies have to have Synagis shots to prevent RSV. Well, she stopped taking her Synagis because she had reached a certain age. Well, guess what? She got RSV, she had pneumonia, and she had asthma on top of that. So we were admitted to the hospital for a week. And so I'm thinking about the story that was told about the text to breathe, and I'm like, wow, if that was available, a few years ago, what that could have done for my family. So I'm just looking at how all of this information is tying into my life and how it may tie into the lives of people that you know, because it is so important to be aware and to be educated. And I'm passionate about those things, and it's such an honor to be able to not only share my story, but to also tie my story into the relevancy of the information that was shared today. Dr. Barfield talked about advancements that are being made in medicine and all of the things that are being done. And I look at my daughter Erin, who's here, and my son Corbin. They were born full term because I was able to get a cerclage, and I got progesterone injections for 20 weeks with both of them. And so they were able to be born full term. But my head is spinning because I'm like, wow, all of this information. And even though we're getting it now, after Lauren, the blessing is we can continue to share it with other people. So even though I'm not in that particular situation, I cannot explain to you all the countless number of times that I've had to speak to people, encourage people, share with moms my experience, and then guide them in the right direction. So take this information with you. It's not just for you, but you're here. So because you're here today, you now have a responsibility to share that information with other people.
And that's all I have to say. Thank you and good evening.
Now, I think that's a first, when a husband cedes to a wife. Really?
It's amazing. You share so much. I forgot I had my own over here, so you saw where I ended up, right? Still sharing the microphone. There are not many things that I boast about other than, obviously, my family and my wife of 11 years, 18 days, 24 hours, and 24 minutes. And counting, and my beautiful family. But I also boast about the fact that I have been a volunteer of the March of Dimes since I was 6 years old.
Wow.
And the amazing part about that story is that you volunteer with an organization. At 6 years old, I didn't even know what the March of Dimes was, but I knew that I got these dime cards, and I went home and I asked my grandparents and my uncles and my aunts for dimes, and we were going to save the babies. And that was at age 6 years old. And so I grew up and, went to college, joined my fraternity, and I just saw that there were so many other organizations who had a partnership with the March of Dimes. And then fast forward, we had Lauren. And fortunately for us, we knew about the March of Dimes. So for us, it was, though it was a very traumatic experience, it's pretty refreshing to see that the cause is still moving forward, and that every year there seems to be new partners who are coming on board. And I have to tell you, Deborah and Anthony, I'm really looking forward to paying my next cell phone bill.
That's sweet. And he's serious, too.
Yeah, I'm very serious, and it would be great if you were like the auto and home insurance folks, where you can pay in advance for the next 6 months and the next year. But I'm delighted to see that partnership is a big part of this. One of the things that we experienced in 2011 and even now, as we traveled across the country, we really focused on a lot of partnerships. We visited a lot of NICUs throughout the country at different hospitals, and it was just amazing to see that partners were developing their own teams, and they were really about the cause, and I'm glad to see that. I'm also excited, I believe we had a couple of partners here that were from New Jersey, but Newark, New Jersey does an excellent job. I want to acknowledge them for the Healthy Babies Are Worth the Wait program. But the community engagement has been a very big one. And there's so much that we heard here today, but when you go back to your own individual communities and you make it meaningful where you are, has been one that a strategy that has worked well for me. I think about Alpha Phi Alpha that I'm a part of. My wife is a part of Alpha Kappa Alpha, and we think about Jack and Jill of America. All these organizations, it's refreshing to know that they're in partnership. So it makes our service to those organizations even more meaningful because they believe in what we believe in, and in some sort of way we're all impacting children. And one of the things that we know is that if you don't start in this world with a healthy life, there's no way for you to continue as an adult with a healthy life. So I just appreciate all of your support and for listening to our story, and I ask that you take that along with you and to also provide back to your own communities.
Not the moderator you were expecting, right? Unfortunately, Ms. Miller did have to leave. She actually came here from an assignment and is on her way now to another assignment. So we're really thankful she was able to join us. And of course, she asked me to say farewell for now. But I think you've heard some really, really rich information, obviously, on the medical care side, from the standpoint of health outcomes and behaviors. You've also heard a lot about modern technology and using technology to really be able to make a difference. And you also heard from our advocates who shared information about their own personal story and why really stepping into this issue was something that's really important to them. So at this time, I actually would like to open up the floor to questions from the audience. And I'm wondering, is there a, let me see, could you please, Gwen, thank you so much, I appreciate it. Gwen Carmen from the March of Dimes has just volunteered to be the runner for us with the microphone. I appreciate that. Thank you so much. So anyone who has questions, if you could raise your hand, please. And if you could just introduce yourself and tell us where you're coming from, we'd appreciate it.
Hello, I'm Monique DeVille. I'm coming from Philly, but originally from Fort Lauderdale, Florida. I'm currently an OBGYN resident in Temple Hospital. So I have two major, comments. With the family that's here, it was interesting you said that you did everything very healthy and you were well aware. And I believe it was the last ACOG conference, which is the OBGYN sort of congress, and they have noted that African American women, despite their socioeconomic status, still had more preterm births than the white counterparts. So you can take a poor African American woman or wealthy, doesn't matter. African American women will still have more preterm births, which was just very interesting. It sort of correlated with what you were saying. And then as far as the texting, I was getting very excited because I also have pregnant teens, and they walk into the clinics with their cell phones in their hands. So I think texting would be like, if there's a program for teenagers with teenage pregnancies, it would be amazing because they'll read their text before they even think of anything else. So I hope to see a lot of those programs in the future develop with Verizon.
So your comment is interesting because CDC, we lead the teen pregnancy winnable battle in trying to address teen pregnancy prevention for African American and Latino youth. And so we talk about the opportunity to think about texting as a communication, and instead of text for baby, we say text for no baby. Because there really may be an opportunity to think about contraception as part of that, as those health information systems.
I also think it's exciting because you learn how to communicate by not forcing them to communicate your way, but by you learning how they communicate and you meet them where they are. And that's an important step, I think, in the right direction.
I will add also just a quick comment. The issue that you raise is one that's incredibly important and has been prevalent for some time. And I remember when I was in graduate school at the Hopkins School of Public Health, that issue came up, and as a result of some work that I had done subsequently, I did come to find out that there are a number of researchers, social scientists, folks who kind of do the intersection of social science and health outcomes, who have started to look more and more at what you could call, for all intents and purposes, the racialized experience that a lot of people have, and in particular here, obviously, we're talking about women, and how, in fact, how the internalized experience of discrimination and racism could actually be impacting their health outcomes, and particularly around the development of babies. Obviously, being able to calculate what that is, and really, obviously, from that standpoint, then if we're really thinking of it that way, thinking about strategies, to really be able to address the problem, obviously go well beyond the healthcare system in and of itself, although that also is certainly a contributing factor. Dr. Barfield, you want to say something?
Yeah, so, the image where we're looking at a woman in pregnancy, again, the issue is that not only is that baby affected, but particularly if that's a baby girl, that baby has developing ovaries that may be affected over time. And that's part of what we're learning, is that some of these issues are transgenerational. So despite education, despite, acquiring increasing income, African Americans still have a history of exposure to factors that may have gone over generations. And so it still may take time, as well as the opportunity to try to increase, and improve health. So, for many, the reason it is not known in terms of preterm birth. So we really need to look at, again, health overall, sustained health over time, in order to try to close the gap.
Just to add a quick comment, and I think going off of what this physician's saying, I think there are theories that increased cortisol levels or stress that African American women's face could be causing some of the preterm births, like the internal cortisol levels and the stress. So, mental health is probably very important as well.
Yes, that's really an important point. And March of Dimes actually recently sponsored a pediatric session that talked about issues related to stress. And, part of the difficulty is that there are a lot of factors in terms of cortisol of the mother, cortisol of the placenta, and cortisol of the baby. And in terms of measuring it, it's fairly complicated. We're also trying to talk with women about stress, their experiences, of sustained stress, of acute stress, and also life events that could create stress.
Any other questions? You're all clear? 100%? No questions? Well, there's one thing I just want to throw out. As we're talking, obviously, about ongoing efforts to really expand community-based health care, especially under the Affordable Care Act, and we heard about all the wonderful technological advances that companies like Verizon are really doing and bringing to bear, if you will, to really help to expand access to care. I wonder what you think, Mr. Lompard, and all of the panelists, about what modern technology can do to really help to expand the work that community-based health workers are actually doing.
Well, I can say that early indications in the program would show that we're increasing capacity in ways that some of these organizations that operate in the community providing care didn't have before. I think that example on the mobile unit of telemedicine means that upwards of, say, 40 specialist appointments a month can be scheduled in a mobile environment when those 40 appointments would have to occur across town. I think it's a short walk to say that that's increased capacity for that particular partner in that city. I think that technology is providing access to electronic health records, which speeds up the process of dealing with with chronic disease and chronic ongoing issues through speeding up appointments, getting information quicker, making a faster diagnosis, reducing the potential for errors. Many of the organizations that work at a community level, community health worker programs, visiting nurses programs, mobile health clinics, if they don't use technology, they operate in the old way. They use paper and they ship it back and forth, or they download access to information at the end of the day or at the end of the week. This makes everything slower. And if there's going to be a larger number of patients in the system over the next couple of years, technology can add agility to organizations that have, solid patient care practices today. They get to move faster. And faster means they may be able to help more people.
You have another question? Okay, and I'll expand on that piece. I know you're speaking from the technology side, and I may be this beautiful woman speaking to you all today, but in my other life, my graduate degree is in social work. I have a master's in social work, and I spent years in the field, and I would have to say from a perspective of someone who works in the community with that at-risk population, I worked for the Department of Social Services in Charlotte, and I can say, had this been available before, it would make it a lot easier for workers who do have to transport children. And, I worked in foster care, so those children were in our legal custody, so I was responsible for everything for them, educationally, health-wise, medically, you name it. And so to be able to have this resource available, some of my kids on my caseload did not, come from families that had adequate transportation or knew how to get around through the system. So this would be a wonderful aspect, because when you have 30, 35 kids on your caseload, you have to see them twice a month and get them everywhere. This is a way for those workers who are on the ground, who are in the trenches, to help connect their clients to the resources that they need. So I'm just giving a round of applause for someone who has been, a foot soldier in working with an at-risk population and understanding how critical it is.
Wonderful.
Yes, yeah. Melanie Newkirk, Los Angeles, California. For the gentleman from Verizon, do you have a program for grandmothers who take care of the babies and what have you, to teach them how to text and what have you? That's very important. I think we were talking, coming over here today, we were saying, well, how many people knew how to go online to RSVP for this luncheon?
Right.
And to print out a ticket, and what the name of the website is. It's, it's more than a notion just to think about it in terms of that. So I was wondering if Verizon is going to initiate a program, either here through your headquarters in Washington or some other places like in Los Angeles, program for such.
That's a very good question. I would say that in our seniors health program, technology adoption among seniors is center of the challenges that we're trying to solve for in our chronic disease management program. I will say that it's really about helping seniors live independently longer, and through the use of technology, and along the way, maybe those seniors will become more comfortable using technology, and maybe they address your question, but I have to admit that a specific program for teaching seniors how to adopt the technology is not within the scope of what I'm doing. But I will tell you that National Association of Community Health Centers, which is based here in Washington, D.C., is an umbrella organization with more than 900 community health clinics across the United States, providing primary care in the most underserved communities across the U.S. Think of these as the formerly federally qualified centers back in the 60s, produced by, funded by the government. We have selected a dozen of these centers, and we are working with these centers and their senior populations to provide technology in the home for those seniors to deal with glucose measuring, blood pressure measuring, weight measures, pulse oximeters, in order to capture biometric data that goes back to the clinic And we're trying to work with these clinics to prove that we can extend independent living in seniors through the use of technology, even if they're living with chronic disease. And the reason why this is important is because one of the worst places for a senior is the hospital. Soon as you reach a certain age, 65 or so, and you start visiting the hospital, it might be the worst place for you to go because your health begins to deteriorate from that point, and then you begin to become more expensive to care for, more expensive for you and the system until you have full assisted care. Until someone has to watch you 24 hours a day, that is the most expensive care for a senior. So if we can use technology to teach seniors to be more comfortable with staying in their own homes and managing their issues through their doctor's office periodically, and the use of technology, and in some cases the use of an occasional visiting nurse, we might be able to prove that the future generations of seniors might be able to live longer at home without having to enter the hospital system.
I'm assuming you're asking, of course, about the foundation, right? Because the caucus focuses, obviously, they focus on legislation. It's certainly something that we can talk about. I think that very much like our Spirit of Healthy Living program, when I hear about issues like this, I think, Mr. Lompard is right. What we have to make sure of is that we are connecting with the people who are actually on the ground and can really ultimately help to be able to get the information, to continue to be resources for people as they have questions, right? So in terms of identifying, potential partners, for example, to work with Verizon, for example, some elder care centers, for example, and, perhaps doing a partnership, that way, potentially even doing something that would bring together seniors and young people, right? There are a lot of efforts that are, intergenerationally focused that could actually work out really well, especially for something like this. That's something that we, can certainly talk about. But I think you're bringing up an excellent point.
Hi, my question is for Verizon. We're part of the Lifestyle Festival, which does a health awareness festival in the U.S. Virgin Islands every year. And was wondering if you all have a presence in those islands at all, and if you all may do the health screenings for the kids at all down there. Is that possible, or?
Yeah, our footprint is U.S. and we don't have a presence in the Caribbean at this time. And just to take that further, so our partnership with Children's Health Fund and the mobile medical units are U.S. based also.
Any other questions at this time? No, she unfortunately had to leave right after bringing her comments. She's got hearings today, so she was only able to come for a very brief time. Yes, ma'am.
Hi, my name is Hillary Karen. I'm from the Department of Agriculture. I work on nutrition issues there. The Congresswoman had mentioned this week there's a big bill coming up in Congress that would potentially cut $40 billion from the SNAP program, formerly known as the food stamp program. Since I work on programs like SNAP and WIC, which helps low-income women, infants, and children, I was wondering if any of the panelists could speak to the importance of nutrition and those kinds of programs for kind of intervening early on to impact health outcomes for low-income women. Specifically, as the doctor had mentioned, because unfortunately during pregnancy is often one of the first times that women come in contact with the healthcare system in a WIC clinic or somewhere else. So I'd be interested to hear your thoughts on how big a difference that can make.
Yeah, I think that nutrition prior to pregnancy, during pregnancy, for early childhood is, very critical in terms of development. So it really is an important area, and there are so many families that have food insecurity, and we're also trying to tackle the issues of obesity where there isn't an opportunity to really get nutritious foods. And we are seeing a lot of exciting opportunities. More recently, business is really getting involved in trying to create healthier food environments, like, Whole Foods most recently. So I hope that this will be something that will be addressed.
And again, I'll speak to that from a social services perspective. Just hearing that makes me think about how that can be a segue for other things. You know, children come into custody or a case is open because of other factors, but you could have a family that's really trying to do their best to provide for their families, but the mother leaves the children at home because she doesn't have someone to care for them, and then they end up getting a case, the children are removed. So I'm thinking about, you know, removing the opportunity for children to be fed, and this mother having to work extra shifts because she needs to be able to feed her family, which could turn into something else. And so I'm looking at it from a perspective of looking at how one thing could become something else for that family, because they're trying to provide, they're trying to have access to resources, and, you know, it could become something else that family necessarily didn't want to happen, but you take one thing away and you could create something else. So it's just so many things that are going through my mind, working with that population that is in such dire need of those resources. To take that away, it could become something else in the long term.
Well, at this time, as we wrap up the session, wanted to make sure, you heard a lot of information, you asked some really, really great questions, but wanted to make sure that the panelists each had a chance to share with you two things. One, a key takeaway item. So out of everything that you hear, there was one thing that they really wanted you to focus on. What would it be? And to keep in mind as you move forward, what would it be? And then secondly, to recommend strategy for advocacy, for really advocating for better services in your community, perhaps in the work that you do, but some way for you to become more civically engaged around this issue. And I'll start with Dr. Barfield.
Yes, so the first thing to just take home is to remember that if we want to improve the health of babies, we need to improve the health of women, and that's before pregnancy. And the other take-home message is, you know, you've heard some very important stories. And what I would just simply suggest is listen to the stories in your community and bring those stories forward to make this a real experience in the work that you're doing in terms of advocacy and policy.
Thank you so much, Mr. Lampard.
Thank you. I would just say that I would suggest that we need to utilize the information that we have at our fingertips to be more informed patients, mothers, family members. We need to take it upon ourselves to understand more about our health and live healthier. And from an involvement perspective, I would say that there usually are more organizations providing care to underserved populations in every city than most people are aware of. I would ask that you find one that supports your community and the underserved people with minorities in your areas, and support those organizations who are trying to really be, you know, safety net providers in this complicated time where, you know, healthcare access and healthcare quality need to improve for everyone, and so support local organizations that are doing that.
Thank you. Mrs. Fleming.
Yes, my takeaway would be to encourage you all to continue to do basically what you're doing today. You came to this luncheon, but were involved in the forum to get information, and so really to continue to be educated and becoming aware about issues that affect the health of women and babies, and then sharing that information with your local communities. We all have an obligation and an opportunity to be public servants, and you don't need a degree to do that. You don't have to have a lot of money to do that. You just have to be alive to do that and be willing to do that. And because you're here today says that you meet both of the criteria, you're alive and you're here. And so just continuing to get that information and sharing that information is the best thing you can do, because you could be the lifeline of information for someone. You could be the person that gives them what they need. And so I know a great way to get information about the mission that we support is to go to marchofdimes.com. There's so much information available on the website, a lot of resources. You may not have had a preterm baby, but you may know someone who did, or you may know someone who knows someone who did. It is so prevalent that I'm sure it has probably touched everyone's life in this room, either directly or indirectly. So that's a great way to get information that you can share with others.
Thank you so much. And Mr. Fleming.
Thank you very much. I would first start by saying that it was such an honor to share with you today. It's always great to be able to share our experiences in a way that you can just feel that people are going to do something with the information. But I actually have two. One is through legislation of the Premium Reauthorization Act, which is one that is currently in Congress now. We're looking for support. You can also find more information on the marchofdimes.com, information about it, to help in the fight to reduce prematurity, which is so important as we've talked about today. The other thing is also one that I'm a big advocate and component of, which is partnership. I think that so many other organizations, service organizations that we can be a part of, have a common mission with the March of Dimes. And I would say that in your own individual communities, there is a 99% chance that you have a March of Dimes chapter or division that's in your area. Please reach out to them, and all types of literacy, assistance with workshops, getting the word out, that is what they're there for. So in the spirit of partnership, whether or not it's through your employer or through another service organizations, please consider the March of Dimes as an advocacy organizations to partner with.
Wonderful. Thank you so much, all of you. Can we please give our panelists and Michelle Miller a big round of applause? And thank you so much to all of you for being here, for your active participation. Two things. Number one, please do complete your survey. You should have gotten one outside when you stepped in. You can leave it with one of our colleagues outside, and we'll make sure to collect them. I promise you, we really do pay attention to what you say. And secondly, we have, for those who might be interested, a very interesting, very wonderful session on STEM education that actually starts at 2:30 in room 140A. So that's the building across the street, first level, room 140A, where you will hear about some trailblazers in STEM education who are doing some really fantastic work to, and I'm sure you'll be both of you actually will be especially interested to hear about this, to really help to increase African American children, youth, and young adults opportunities around STEM education. So thank you all so much, and definitely please enjoy the rest of the conference.